The 4AT, a rapid delirium screening tool you can complete in under 2 minutes. The 4AT is an evidence-based screening tool for detecting delirium. The 4 A's stand for alertness, AMT4, attention, and acute change. It requires no special training and has been validated in over 30 studies with more than 6,000 patients. Component 1, alertness. Observe the patient's level of consciousness on initial approach. Note any drowsiness or agitation. If asleep, attempt to wake them using speech or gentle touch. Normal alertness scores 0. Any clearly abnormal presentation scores 4 points immediately. Component 2, the abbreviated mental test, or AMT4. Ask the patient 4 orientation questions: their age, their date of birth, the name of this place, and the current year. No mistakes scores 0. 1 mistake scores 1 point. 2 or more mistakes, or if the patient cannot respond meaningfully, scores 2 points. Component 3, attention. Ask the patient to recite the months of the year backwards, starting from December. 1 prompt is allowed. If they get 7 or more months correct, score 0. Fewer than 7 months or refusal scores 1 point. If the patient is too drowsy or unable to attempt the task, score 2 points. Component 4, acute change or fluctuation. Look for significant changes over the past 2 weeks with evidence in the last 24 hours. This includes alterations in alertness, cognition, paranoia, or hallucinations. Use information from staff, medical records, and family. No evidence of change scores 0. Clear evidence presents scores 4 points. Now let's interpret the results. The total score ranges from 0 to 12. A score of 4 or more suggests possible delirium and warrants further clinical assessment. A score of 1 to 3 indicates cognitive impairment without clear delirium indicators. A score of 0 means delirium or severe cognitive impairment is unlikely. Remember, a positive result is not diagnostic. Clinical judgment remains essential in every case. The 4AT, rapid, reliable delirium screening in under 2 minutes. Learn more at the4at.com.